Okay, so this is the first Med Lab for oral, buccal, and sublingual medications. I'm starting at my med cart with my doctor's order, my MAR here. I'm going to perform hand hygiene. That was cool. Before I prepare the meds. I'm going to make sure that I have my med cups ready for my medications. And yeah. First things first, I'm going to grab my metformin from my drug cart here. And we're going to look at the packaging, and we're just going to make sure that it is the right drug, which is metformin, the right dose, 500 milligrams. I'm going to pretend that one tablet is 500 milligrams. Taken orally twice daily. So this is a tablet. She's obviously going to be taking it orally. And twice daily, this will be her first dose. So I'm just going to put that into my med cup there. And again, just making sure it's for Tom Ford. It is metformin, 500 milligrams. She's going to be taking it orally, and this is her first dose at 8 a.m. You're going to check before you put it into the cup and after you put it back into the med cart. Those are your first two checks for the rights of medication, right route, right dose, right patient, right time, and right reason. Okay, and the next drug we're going to do is nitroglycerin, 0.4 milligrams sublingually every 5 minutes times 3 as per needed. Okay, so I'm going to go into my med cart again. I'm going to grab my nitroglycerin and 0.4 milligrams every 5 minutes times 3 PRN. So I'm just going to that into my cup there. And again, making sure that it is for Tom Ford, taken orally as per needed, the right dose, 0.4 milligrams. And yeah, that was our second check of our second medication. So now that we have our medications prepared, I'm going to go to my patient's bed, and I'm going to perform vital signs and administer her medications. Okay. Make sure you have your MAR, your medicines, and all your supplies to take your vital signs. Just going over here. That is my patient in bed. Okay. While you're at the med cart, you would be doing your medication research so that once you get to the bedside, you can tell your patient contraindications, side effects, other informations about the medication that they're going to be taking, because you want the client to be educated in the medication that they are going to be taking. It's part of your job. So before you go into the room and touch your patient, you are again going to perform hand hygiene. And you are going to walk in, close the door, provide privacy, introduce yourself. Hi, my name's Taylor. I'm going to be your nurse for today. You're going to want to ID your patient. Can I just see your wristband? Can you tell me your name? Tom Ford, and your date of birth, 24th of June, 1938. Great. So you know that your client is orientated to self and time, and you have now ID'd your patient, so you can move on into your vital signs. I'm gonna start off with my blood pressure reading. You're gonna wanna make sure that the bed is at a good working height for you to do this. Again, I am sitting on the side of my bed just because it is very short. Okay, sorry. Just gonna put this around her arm. Make sure I can read it. Put that right there. Okay, blood pressure is 120/80, which is very good, within normal ranges. Now I'll be taking her oxygen and her temperature at the same time. So we'll clip the oxygen onto her finger and take the temperature. Okay, we'll say she's at 37 degrees, and her oxygen reading is at 98 with room air, which is also within normal ranges. Very good. And now I'm just gonna finish with taking her pulse and respirations. Take her hand, stomach, and count that for 1 minute. Okay, we'll say that her breaths are 12 per minute and her pulse is strong and at 84 beats per minute, which is all very good. None of those vital signs show me that she's in distress or in any danger. She seems perfectly good and stable right now. All right, so now I'm just going to tell my patient that we are going to be giving her nitroglycerin and her metformin for today. She can refuse if she wants to. We're just gonna say that grab the MAR here, and we'll give her her metformin first. If the patient, you're gonna ask the patient if they're having any difficulty swallowing, and if they are, you're not gonna give the medication yet. Just wait. If they're okay with swallowing it, you can give it to them and they can do it themselves, either taking it out of the med cup or just taking it through the med cup. So I just gave that to her. I'm just going to let her know that this is for her type 2 diabetes. Some of the side effects include weakness, diarrhea, chest discomfort, other stuff like that. So if you have any of those, just make sure you ring your call bell and someone will be here to help you. And now we will be giving her her nitroglycerin sublingually. For this one, you're going to want to teach your patient that you're going to put it on underneath the tongue. They cannot swallow or chew it because that way it will not get absorbed into the body. It needs to be absorbed through the mucus in the mouth. So just make sure that they know to put it under their tongue and let it dissolve. Give that to her. She can do that or whatever. She did. Very good. And then for buccal medication administration, you are going to tell the patient to stick their tongue out. You're going to put the pill on the tongue, and they're going to press it against their cheek so that it can be absorbed through the mucus in the sheet, or in the cheek, sorry. Yeah, and I think that's it. So now we are going to go back to our med cart, and I am going to make sure I sign for the medications that I just administered on the right day at the right time. Nitroglycerin. Okay, very good. Make sure you leave your patient with the call bell in hand in case if they do have any adverse reactions or side effects to those drugs. Make sure that they are educated on all those side effects and contraindications and adverse effects and other stuff like that. Make sure you document right, make sure you sign the MAR right, which I did. Leave the patient in a comfortable position, and yeah.